April is National Minority Health Month, a time to raise awareness about healthcare disparities and the history that led to these challenges. History that includes J. Marion Sims, a physician in Alabama who operated on enslaved black women without consent or anesthesia, or the infamous Tuskegee experiment. Hundreds of African-American men were promised free medical care, but researchers knowingly withheld their diagnosis and treatment to syphilis, a deadly disease with no cure at the time, and more than 100 people died. Decades later, our I-Team found healthcare disparities are prevalent in this region. Now a new company is trying to change that. Our senior investigative reporter, Paula Vassan, on the efforts of one pharmacist to build trust, better access, and better care.
And it's like when you get a certain age, it's like they put you in this grave.
For so long, 86-year-old Gwendolyn Favez felt like her doctors just didn't care.
Because they didn't pay no attention. There's no communication with the doctor. They don't talk to you anymore.
For years, she's been on Medicare, federal health insurance for people 65 and older. She felt like a number with too many medications.
This is my Coumadin.
27 to be exact.
I don't even know how to pronounce it half the time.
How you been doing?
For conditions like lupus, heart disease, and arthritis.
Take your time.
Her nephew and caregiver, Patrick O'Neill, was bracing for goodbye.
My aunt was literally lying, sitting in her chair like a vegetable.
Everything changed when they came across a different type of pharmacy.
Would you say Greater Health Pharmacy saved your aunt's life?
Yes, they did. Yes, they did.
Providing culturally responsive, radically inclusive services to a diverse community is really important.
Marcus Howard is the founder of Greater Health Pharmacy in the West End.
In order for our community to become healthier, we have to bridge that trust gap.
It's this data right here Howard analyzed when deciding where and how to open his pharmacy. Researchers have found about 15% of people in the city of St. Louis live more than a mile away from a pharmacy. Others lack access to transportation.
Go ahead, sit down.
And others, like Favez, don't feel listened to. So they skip medication. Their health suffers.
They feel more comfortable calling us, talking to one of our pharmacists who looks like them, who sounds like them, who can connect with them.
And research shows people on public insurance can suffer the most. Fewer physicians accept Medicaid, for example, health insurance for people with typically lower incomes. Doctors who see Medicaid patients also generally get paid less. That can impact quality. Doctors have less time to spend with patients. Here, a pharmacist sat down with Favez for an hour to go through her medications.
They make you feel like you are special. They make you feel like, these people love you.
Hey, how you doing, Miss Jackson?
They offer free delivery.
Thank you so much.
In fact, Howard often does it himself.
Thank you.
Right now, he says he's looking for investors to help sustain his work. Work that O'Neill believes is the reason his aunt is still alive.
Just because the medications changed, she had her energy back. She had more life to her.
Greater Health Pharmacy is funded through the Missouri Foundation for Health. Right now, they're working to triple their patient count by the end of next year. If you want to become a patient, you can call them during normal business hours at 314-200-5313. For the I-Team, Paula Vassan, 5 on your side.